Hello, my name is Dr Danya Bushwereb. I'm a consultant family medicine in Emirates, and today I'm going to present fainting and funny turns in children and adolescents. The most common clinical scenario, we will see a mom very stressed, worried. She brought her child who had a funny turn or had lost the conscious, and this incident of loss in consciousness for the child, it could be witnessed or even maybe sometimes even not witnessed. So what is a funny turn? A funny turn, the definition of it, it's a brief loss of consciousness, which is associated with loss of postural tone, and usually the recovery will be spontaneous. Up to 15% of children, they will experience a funny turn or loss of consciousness, whether it was in their childhood or even like if they're teenagers in their adolescence. So the cause behind it is not really fully understood. We don't really know all of the causes, but there are some common causes of funny turns. The most common one is dropping the blood pressure when somebody stands up, postural hypertension, or it could be maybe a vasovagal, which I will explain about it in a few seconds. And also it could be due to heart problem or even because of a nerve problem. So the most common cause, it is vasovagal syncope and postural hypertension, as I mentioned, if the child drops their blood pressure if they stand up. So what is the vasovagal syncope and what are the symptoms? Before we speak about the symptoms and the causes, it's important to know more than 50% of funny turns in children, it's because of vasovagal or because of postural hypertension. So what are the symptoms of vasovagal? First of all, the mom or even the child, they will say I felt really dizzy, lightheaded. Sometimes they feel clammy. They become pale. Sometimes they feel warm. The skin sometimes it feels cold. They feel nauseous, as if they're gonna vomit. Sometimes they hear ringing in their ears. They will have sweating, and even they will mention the vision is, it becomes funny, it's blurred, and even they will experience tunnel vision. So what is the pathophysiology behind vasovagal? So it's usually because a trigger. The trigger, it could be emotional trigger, it could be environmental trigger. So what are the famous triggers which happen for, not necessarily for children or adolescents, even for adults, because vasovagal can happen in adults, can happen it's very common even among elderly. It could be sometimes prolonged standing, fasting, maybe if they're not drinking enough fluids, or even sometimes maybe seeing blood or needles. What will happen when somebody sees something, or if there's a trigger that will activate in the brain, it will activate the parasympathetic nerve system, and that will send a signal to the heart and to the blood vessels. After that, so what will happen to the blood vessels? They will dilate, and that will drop the blood pressure. And when the signal, when the trigger, when it comes to the brain, and then the brain sends the signal through the parasympathetic nerve system to the heart will slow down a bit. So bradycardia will happen. So that will drop the blood pressure, as I said, and also reduction in brain oxygen supply will happen. Okay, and that will lead to loss of consciousness. So it's so that's the reason behind it. That's why they experience the dizziness, the lightheadedness, become pale, they feel nauseous. And of course, when the heart becomes slower and able to recover, they start to have after that palpitations, and the vision becomes blurry. So what are the other causes of syncope or of funny turns, which is less common? It could be heart problems. So it could be maybe if somebody has, if the child has a congenital heart problem, if they have an enlarged heart, or if there's an infection in it, or any congenital heart anomalies, or if the rhythm is not very, is not regular. But this is less common. And how can we differentiate between it and between the most common one, which is the vasovagal or postural hypertension? It's usually the vasovagal. What will happen that the child or the person will say well, actually I remember what happened. I remember that I felt dizzy. I remember that my vision becomes blurred. I remember I felt nauseous, and then after that I don't remember because I lost conscious. So that's the difference. But if the cause of fainting it's because of the heart, they will tell you I cannot remember anything. So the best question I always like to ask them, what was the color of the floor? Do you remember it? So if they tell you like things like, yeah, I remember that, like for example, I hold into like something in equipment, and I remember, yeah, the floor was like this, and there was somebody looking. So if they tell you like these details, usually it's a vasovagal. But if it was because of a heart problem, and like if like because of cardiomyopathy, or like if there's a problem in the heart, and then they will tell you, well, I've just blacked out and I don't remember anything. And then, of course, we have other causes, which is neurological problems due to nerves of the body, and the most famous one is seizure. But again, I mean, again, it's less common because more than 50% is because of vasovagal and because of postural hypertension. It could be also because of like if somebody has diabetes, and if the child is on insulin, they drop the blood sugar because of that, or if, for example, if they have allergy, they went into anaphylaxis, or sometimes even because of maybe if they sat in the sun for a long while and that led to a heat stroke, or maybe because like they had like they did some exercise and suddenly they got hot, and after that they felt lightheaded, and after that they had a funny turn. It's important also like to be mindful that the cause behind funny turns also can be because of electrolyte disturbance, such as like potassium of the body, whether it was high or low magnesium, or even low calcium. So if you're a doctor and you're listening, and you had a patient, a mom with a child she's very worried, and why my child like fainted, first of all, reassure her, tell her that more than 60% is because of like if they drop the blood pressure, or because of a trigger which happened, like because of the vasovagal, and just explain it in like a simple way. Vasovagal, it happens because of because a trigger, the way, whether it was emotional or environmental, and then just explain, yeah, the pathophysiology like in a simple way. And because of like nerves, because of the parasympathetic nerve system, which caused all of this, which affected like the blood vessels, and led to the blood vessels to get dilated and drop blood pressure, and also led the heart to slow down, and the heart try to recover by palpitation, and that's why all of this happened, the lightheaded, the dizziness, the sweating, the pain, all of them. So you will start by simple things if you're a family medicine doctor or your GP. So first thing, check the blood pressure while laying and standing. So if there's like a difference between the blood pressure laying and standing, for example, if they drop the blood pressure when standing, so that means it's a postural hypertension. So just encourage them to drink more fluids. You can even maybe like refer them to Falls Clinic, while the internal medicine doctor, they will do like a test called tilt test, and that's where it's more advanced. Basically, they will see the blood pressure when in different positions. So that's the first thing. The second thing will be bloods. Of course, we need to check the blood sugar, the magnesium, the calcium, full blood count, make sure they're not anemic, and also, of course, electrolyte. We need to check potassium and sodium, all of that. And then ECG is very important to make sure like it's a normal, the rhythm of the heart, it's regular. There's no like it's not irregular. There's no arrhythmias. There's no like problems in the ECG. So if we suspect it's a postural hypertension, we may refer, as I said, to a full clinic for the tilt test. If we suspect that it's a cardiology problem, for example, as I said, if the child or the mom said like the history that the child doesn't remember anything at all, they cannot remember all of like the details, so it could be a cardiology problem, and then of course just to refer to the cardiology. And then if we suspect, of course, an epilepsy, if there was like in the history that the child had bitten their tongue, or they rolled their eyes up, or if there was like shaking of convulsion, of course, and then a neurology referral needs to be done to get like further imaging or further testing. Okay, so thank you very much for listening. If any questions, please write in the comment section.